All right, good morning. 11 o'clock, good afternoon for some people. Thanks for joining us. Really excited about what's happening this week. I can see your energy coming through the screen. You're ready to go. We had a good stand-up this morning with the team. Everyone is super excited about the challenge. Yeah, you've seen it. I think most of the team here has seen it. We have 35 people here, broken up into groups of 6. And yeah, we're ready to go on the challenge. I'm going to do a really short introduction, 5 to 10 seconds. So Tollulah is somebody who I first heard about back in 2015, and we've collaborated more extensively in 2016. So she's working somewhere at the intersection of public policy, public health, medicine. And one of the biggest things that I would say stands out to me about her is that she actually gets stuff done. And that's why we're excited to work together over the coming 2 weeks. I think that the challenge that she set down is to try and gather information so that she can go on and do something with it. So without further ado, I'm just going to hand over to you, Tollulah. So I'd love it if you take this as this is the team. You've set up the challenge. And even though we only have 2 weeks, I think everyone is united in their enthusiasm for what they're able to get done. So over to you.
Okay, thanks, Arun. Would it be helpful if I gave a bit of a context to this a little bit?
Yes, please, as much as possible.
Okay. Can I share my screen?
Yeah, you can present.
Okay.
Bottom right-ish corner. Bottom right side, if not the bottom.
Yes, got it. Window. Okay. This. Oh, hold on a second. I just need to change my settings. Oh goodness, no, it doesn't let me do that. Hold on, I'm just going to go out and come back in again quickly.
Yeah.
Is that right? Okay, so let's do that again. All right, can you see my screen?
Yeah, it's there you go. Yep.
Okay. All right. Well, lovely to meet you all, and I look forward to working with you over the next couple of weeks. I just put a few slides together just from stuff I've done before, just to give you good context. And you see I've called this Healthy Sustainable Development in the era of COVID, and with a focus on air quality and food, because that's what the focus of the challenge is. So just to give you a little bit of context, can you still see my screen?
Yeah, we can.
Okay, good. So if we think about, I'm sure you've got very different backgrounds, so I'll just assume nothing and just talk a little about what we know, what we knew about the urban environment and health before this whole COVID thing. So this is urbanization and urbanization trends across the world. And the key thing really to take away from this is that we can see for the African region, although we're starting at a lower level, the different colors indicate the growth over the next up to 2050. So you can see, whereas North America and Europe started at higher levels, what you're seeing is this incredible growth in the urban environment in Africa in the coming years. Why is this important? Because when we think about urbanization, we often think about the buildings and skyscrapers, etc. But I think about this more in the context of the exposures that what we're exposed to by virtue of being in the urban environment. This is what I call the 8 S's. Makes it easy to remember. So if nothing else, you go away from this thinking about the urban exposure as sugar and salt, which is a food environment, sports and access to physical activity, sleep and stress, which relate to noise, safe housing, social cohesion, smoking, and smoke, which is air pollution, but starts with an S, so makes it easy to remember. And what you can see is that all of those exposures really contribute to a myriad of diseases. So when we think about these diseases, we often think about, if I say normally, if we think about health in cities, people think about clinics and hospitals, but how often do we think about the air we breathe, the food environment as being important determinants of these health conditions, which are all increasing across the African continent? So the real critical question that we constantly focused on is how can we better make these connections? So understanding the links between urban exposures to disease, and how can health be sustained and impacted at scale through intervening in those exposures. One of the critical challenges that we face is that these exposures are very rarely, are very poorly measured. So if you look at smoke, for example, air pollution, we know that it's something like 7 countries across the continent that have cities where air quality is measured, where we have significant surveillance of air quality, which is really quite significant. And I'll point you to a paper at the end if you wanted to read more about that. So that's urbanization. More broadly, when we think about how it fits, not just within human health, but the ecosystems that we depend upon. So planetary health is that balance between human health, the natural environment to depend upon, and the built environment around us. And what we can see is this triangle between the environment, the host, which is us, and contagion. The contagion could be a pathogen like COVID. It could be a pollutant like air quality, or indeed poor food environments as a pollutant. And you can see that our vulnerability to disease, the risk of transmission and disruption, the risk of emergence of new conditions are all it's an relationship between these three points. So we are where we are, partly because we have cities that are growing and disrupting the ecology. So we're pushing boundaries of human settlements that facilitate transmission of disease, that increase vulnerability to disease, and where we have inequitable access to care, to healthcare. But often when we think about improving health, we focus almost entirely solely on this. And this is important, obviously, because we have disease that exists at the moment. But I focus much more on this aspect of things because we know that 80% of factors that influence health lie outside of the healthcare sector. So the key question is, how can we better understand those exposures in order to create health? So maybe I'll leave with this one. If we think about health differently, so we normally think about health services like the healthcare and exposures like, whether or not you have affordable healthcare and long-term outcomes like death and illness. But if we think differently about health services, we think about human settlements and urban planning as health services, right? So you can start to see how the housing and the built environment determine the exposures, whether you're in a ventilated space or you have physical activity opportunities, whether you're exposed to air pollution. We know that those relate to whether you're physically active, your admissions to hospital, and ultimately your risk of lung disease, high blood pressure, mental ill health, and infectious disease. Oh, sorry. Same with transport. Huge connections between noise and air pollution, same with waste and water, same with the food environment. So the reason why, if you're wondering why a public health person is setting a challenge for air quality in food, is exactly because I see those as key and critical health services that impact the long-term health. So how can we better measure these services and those exposures and harness them to positively create health? I'm not going to go through this, sorry, it's a simple thing. This is, I think, where I leave you. How do we think about this in the context of COVID? How do we materialize this in the context of COVID? It's a very rough kind of spider diagram, and if it's confusing, that's because it is complex. But if we work backwards from thinking about the risk of emerging new infections like COVID, or we think about asthma and chronic obstructive disease or diabetes or obesity, if we work backwards and we think, well, what do we know associated? So if we start from COVID, we know that obesity and asthma and diabetes are associated with poor outcomes from COVID, increased risk of hospitalization. We know that if we look at the orange, transmission factors, things that influence risk of transmission, that comes from safe housing, comes from cohesion, comes from your healthcare system, access to hygiene, physical activity. But if we look at something like diabetes, we know it relates to our food quality. If we look at something like obesity, we know it relates to both food and physical activity. By the way, we also know that I could draw a straight line from air pollution all the way down to COVID, because there's emerging evidence that your exposure to air pollution increases the risk of severe COVID as well. So you start to see how on one end we see the end product, but we very seldom join the dots and think further up. And that's what this challenge is about, to say, well, how can we make health a primary indicator when we think about urban development? Okay, so this is where I want to leave you with. So the numbers in brackets are the SDGs. This shows how we think about the balance between our health risk and health outcomes on one end, and the systems for health that I showed you earlier, that support our life and support our well-being. And in between, these resilience factors that really influence our risk and our vulnerability and susceptibility to disease. And you'll see in there, and I just wanted to highlight that I've selected in this one aspect of the natural environment and one aspect of the built environment for this challenge. So that's the air and that's the food. And you can see in terms of thinking about resilience, understanding our food security and healthy food access, understanding our air pollution exposure is really critical to understanding how best to prevent disease and promote and protect health. So, but those are the very things that we know with the COVID pandemic have been disrupted. And so the idea for this challenge is essentially that. I mentioned about air pollution and how little we know. This is the link I was talking about, who wrote a piece for 7th of September, which is World Clean Air Day, the first ever, about what we know about air pollution and disease and in the context of Africa. So I would recommend you have a look at that piece as well. But the real drivers for this challenge are just that. So because we know that air quality is impacted. I'm sure you all had this experience or heard of somebody who thought, oh, during lockdown, was it easier to breathe? Was the visibility better? But we don't actually have the data because in a lot of these cities, air pollution and air quality isn't measured. So all we have are just experiences here and there. So the question is, can we deduce from social media what was happening around it, people's experiences around air quality during the lockdown and in the aftermath? So, for example, I do some work in Lagos. I'm Nigerian, and we know that one of the projects that we've got going on at the moment, for example, was completely influenced by the fact that we saw during lockdown people going out onto the streets and onto big motorways to do like impromptu gyms and physical activity because it was safer, the air was cleaner. So we have this understanding that was happening, but we don't actually have a sense of what people felt around air pollution. From a food side of things, we know that obviously food insecurity has increased significantly, and this is something that's happened globally. I'm sitting in London at the moment and is the same. Food poverty has gone up significantly as a result of particularly around the lockdown, because people are not able to access their usual support networks and maybe proximity to food, particularly with markets shutting and that sort of thing. So really trying to understand how access to food is being spoken about, so the sentiments around that and who is speaking about that. And then lastly, around food quality, because we know it's not just access to food. Obviously, access to food is critical, but we know that unhealthy food is an important driver of disease. So wanting to get a better understanding of, in providing the palliatives and the mitigation for to prevent hunger, who are the actors in that space? Is it government doing that? Is it NGOs doing that? Is it private sector? We know from other settings outside of Africa, some anecdotal evidence that there's been some food industry action supporting and providing food, but providing more unhealthy food. Right, so you've got to then wonder, how does this impact on health in the long term? So the ideas for this challenge is really wanting to understand a little bit about what's going on there, based on what you produce. That would really help inform my hypothesis generation. So at the moment we just have anecdotes, but can we create some evidence that generates some hypothesis that will go into and feed directly into grants that we're developing writing at the moment. So the work that you would be doing is so critical for my work, and so I really look forward to seeing what you come up with. Depending on what comes out, if you're able to find something that's and put together something that's useful and of high quality, then we could look at, and I'm sure this is something that perhaps Yabba will speak about, submitting it as a preprint, so there's an output there that we can directly link to that hypothesis generating work for the grant submissions. So that's really a little bit of the background to why I pose this challenge to you. So I'll stop there.
Tollulah, I just want to jump in and ask you a couple of questions. So can you tell us more about what would a really successful outcome look like from one of the project submissions? And second question is, what happens if there isn't conclusive evidence? What if the answer is kind of?
In some extent, I'll answer the second one first. To some extent, I wouldn't expect conclusive evidence. The question is more about throwing stuff up into the air. So what would be helpful would be some sort of improved understanding of, so if you could tell me, so from air, for example, what were the sentiments around that? So was it just my mates who I have in Lagos and Yaoundé says, or was there increased discussion around air quality and what would people feel? How did that change? So just a better understanding. And from a food perspective, the really critical things I want to know are who is playing in that space. So who are the actors who is talking about this and who is intervening. So when you say conclusiveness, they don't necessarily all converge, but if you diverge into, here are 4 different types of themes that we found. So that's why I called it hypothesis generating, because I think undoubtedly what you will come out with will be the basis for further research as opposed to the end of the question. So it really is to say, it would be helpful to guide, because my research at the moment, the grant could go lots of different ways. So it'd be really helpful to say, okay, we've had a look at the data out there, and that tells us that these are the kind of 3 areas that seem to be coming up a lot, or these are the 3 critical issues that people seem to have been speaking about related to this. And then that gives an idea to say, okay, that's what we will focus on, or we'll pick one of these. And it gives us strong rationale for writing a follow-on grant based on that. Does that make sense?
Absolutely, yep. In terms of what does a really successful output look like for you, what would be sort of a home run success for you? In terms of what you get from the groups.
Yeah, so if I could get something that was preprint ready, because it would really help with the grant that we're working on at the moment, because then I could cite it. I will use it anyway. I will use what you come up with anyway, but it's just a lot stronger if if the work can be cited somewhere. And obviously we don't have enough time to go through the peer review process, but if you have outputs that can be at the level of being submitted as a preprint, that would be really helpful.
Okay. What about the fact that it's we're only looking at one data source, Twitter, and there's different countries that are differently represented. How would you guide our teams around that?
Yeah, I mean, that's a good question. So the countries that to some extent, it depends on the data that are out there. So I haven't been very country specific in posing the challenge, because didn't necessarily want to restrict. So, you know, if we're over restricted and you didn't find anything, you think, well, was it just that country?
So my suggestion, one suggestion would be like, do we know beforehand that there are countries like Lagos, you mentioned, I mean, like cities or countries, like in the city case, like you mentioned, Lagos, where we know that air quality is a major problem, then that becomes a high filter, you know, like in such a way that, you know, a reduction, you would easily see it. And also there is the Google mobility data for some of the countries, which can actually tell us a lot more about the like the reduction in traffic, which then probably we can use it as a proxy. So probably we could focus on areas, if you know already some you know, countries, cities where this is a big problem, then that would be starting point.
I mean, unfortunately, it's really, you could pretty much assume that the big cities have this as a problem. I was going to say that the countries that I'm currently working in, so maybe then the overlap is or the cities, is Lagos in Nigeria, Nairobi, and so from Lagos perspective, we know the air quality is not good. I also know that there was some government interventions around food to the poor, etc. So I know that there was some action in that space. In Kenya as well, we have Nairobi and Kisumu are the two cities that I'm been doing some work in, and I know again that firstly that there was lockdown, and secondly that there was some government intervention around the food space. And I think one of the papers I shared with you had that information and gave examples of the government intervention in that space. Cameroon is another country I work in, but I'm not sure about that for two reasons. One, because you may not get, because, you know, it's predominantly Francophone, it's dual, but, you know, so you may be limited in that sense. But also they didn't go into as restrictive lockdowns as other countries. So they may not have been such a drastic change. And I would say maybe the last country that would be important to look at is South Africa. So that's somewhere else that I do work, both in Cape Town and Johannesburg. And we know that the air pollution is, you know, fluctuates significantly there. And again, we know that there was strong and early lockdown restrictions in place, and that there were government interventions. So I think I would, if you had to kind of whittle down, those would be the, you know, those cities in Nigeria, Kenya, and South Africa would probably be the cities I would say to focus on. Also because we know that there were lockdown restrictions and there were some interventions to provide food for the poor. So yeah, so if you were going to narrow it down, I would say probably those.
Okay, you have a bill?
No, I mean, I think that's good. I think having the three countries as a focus and everything else just as extra would be, I think, kind of gives it a definition. And another one question I would like to ask is that, so you said a few cities or places there is actual monitoring, surveillance. So do we have that data, or can we get that data? Because that tells us if there is some kind of correlation between actual measurement and this thing.
So there is one way of getting, so the University of, it's a really random American university. It's Wisconsin or Minnesota. I can find this. They have open source. So essentially, a few countries, places where we have any kind of air quality measures whatsoever, tend to be from the US Embassy. So a lot of US embassies worldwide have air quality monitors where they are. It doesn't give you a sense of a citywide, but it gives you some measurement. So I think that particular university captures that information. I don't know if that wouldn't be, I don't know if that would be possible, because obviously there is, from your end, because there's another level of analysis required on the air quality measurements side of things. But what I would say, so the World Bank, I should have added this to the reading. The World Bank's climate or energy program have they just released, for example, let me see if I can find it, a report on air pollution in Lagos. The cost of air pollution in Lagos. I'm just going to copy the link into the chat here. She says, not really sure how to, there we go. So that particular branch of, so this report was just launched, and it's quite detailed. It doesn't have the raw data, but that would be somewhere, if you had any, I don't have direct connections to that program at the World Bank, but they would have access to quite a bit of data. So yeah, it's a bit challenging, to be honest, because and that's why, that's why this is necessary, because it's quite a bit of work just to get a sense of what's happening from an air quality perspective in the majority of cities on the continent.
Yeah. So for Ethiopia, for example, I was looking exactly the US embassies. They have only one in Addis Ababa, but I haven't looked at how many other places. I know that they have one in Kenya, but it's just, and I was plotting during just in the beginning of the COVID, actually, that to see if there was some change. And wasn't, because it's inside one place, it was not actually in an area that is kind of whatever. It doesn't tell you, but I think it is good. There is a satellite image we could do, like so I think the MIT has these carbon footprints and stuff like that, but we could look at. I think that's one other possibility. But just keeping, if you come up with an idea like where we can get that data, if there is like cities monitoring, I think that could calibrate our sensitivity of the.
I can tell you I think the city I know that has the most what could come close to being called surveillance is Kampala. Actually, Kampala has a sensing network across the city of something like 30 different monitors. That is not just the US Embassy. So is
that the Boda network?
Sorry?
Is that the Boda network where they install it in the motorbikes and then they?
No. Actually, static monitors. So I'm just trying to see. So it really is few and far between. It's if you read that WEF piece that I wrote, it's and you read the World Bank report, it really is, it's really striking. It's, considering how much of a threat this poses to health, that we're not even measuring it's just incredible. So this is the report that I quoted in that around I just posted there around the air quality measurement. So you have a sense of it's yeah.
Okay.
I would say for the
what
time frame that you've got, really, it's, I mean, one of my projects is around, it really is quite a lot of work to find those data and pull them together.
Yeah, but for me, the interesting part would be the calibration, because, you know, it's one thing to detect a signal, and the other thing is calibrating that signal, whether this is actually noise or a signal, right? So in that way, like if we could add now Kampala, Uganda as control, so where like we can kind of use their, like, you know, if we get some tweets that are kind of like improving, and then if we try to then go into that data and see like that, then that would really establish some kind of like the gain.
So so there would be just a handful of cities you could do that for. Kampala would be one of them. Yes.
Yeah, I think the sentinels we have definitely. So given that a group is 6, I think I would like also some other in the group to actually look for other calibrators, because ultimately any signal is about how much we calibrate it. So but let's brainstorm that. And but good thing is that it's fixed the countries. Like we have the 3 countries as a primary one, and probably Uganda as a calibrator, and then all the rest kind of will so I'm happy with that.
Tollulah, there's a question about a little bit more information on what you're looking for in terms of food quantity.
Okay. So it really is to, especially doing a comparison between cities, to get a sense of the kind of sentiments around food insecurity. So what I mentioned in the challenges is around access to food. So how people are, so what people are talking about with respect to access to food, just agnostic to the quality of food. So is there more talk about hunger and about access to food, because there's a potential indirect consequence of the lockdown restrictions on access to food. So understanding the factors that are being spoken about around access to food. So is it around the markets that were closing and how that impacted? And then thirdly, the mitigation of access to food. So what was being done around the lockdown time and since, related to access to food, and by whom? So what was the government doing? What were nonprofits doing? What were private sectors doing? So it's really getting a sense of what people are speaking about around access to food, how the restrictions, the control measures, how they're speaking about it in the context of the control measures, and who is being active in that space. Who are the key actors and key communities active in the space around addressing the food insecurity?
Okay.
Does that answer your question?
I think so. There's another question. So there's a question from one of the team members. Another question is more light on how air pollution helps to curb or spread COVID-19.
So it wasn't spread. So it was the connection between. So there's been emerging evidence that long-term exposure to air pollution increases vulnerability to severe disease. So in the same way that we know that having heart disease or being older or having asthma increase your obesity, increase your risk of severe disease and hospitalization. In the same way, there's emerging evidence that exposure to air pollution increases the risk of severe getting sick with COVID and of developing more severe disease.
Okay. Any other questions from the team? You can just put it in the chat box. So while we're doing that, Tollulah, the sort of rhythm, and I think you've seen this in the challenges, that we'll be submitting something back to you next Saturday as sort of a first set of findings, a set of questions. We may be coming back to you with questions. We'll funnel that through Yababel and me, so you're not getting hit from many different sides. So that will be happening middle of the week, kind of a formal write-up coming to you at the end of the week, and then using that to help make sure that we're going in the right direction, and then the final write-up and report at the end of next week. So I don't know if you can see the chat box. There's a question there. What's the minimum you're looking for? Can we focus on the government intervention on food quantity? I'm not sure if,
Yeah, it really does depend on what's there. So if there's a city where it's almost entirely the NGOs that are providing the food, then it may not be, it depends on what is there. And I don't know how that plays out in different cities. So I think it would be worth looking initially to see what the signals that you're getting as in terms of the actors that are playing in that space. And if it's overwhelmingly, say, government intervention, then there might be some rationale for, okay, let's focus on that and see how that is being received, what the issues are, etc. But if there are a lot of actors in that space, and there's a lot of signal coming across the board, then it would strike me as important to keep them all in play.
Okay. Anyone else? Last call. So if there are no more questions, Tollulah, if you have 5 minutes, maybe you could give us a quick, your 5-minute story, and then we'll let you go.
Give my what, sorry?
5-minute story.
Oh.
From Lagos to where you are now.
Oh, goodness. You want the short version of...
Well, I mean, we're booked up to for the next 20 minutes, but
okay.
assuming that you have other stuff to do, at least the 5-minute story.
No, I'd be happy to. So you just want to hear how I've got to where I am now?
Tell us. Okay.
So I was born in a small town you may have heard of called Lagos, which at last count now has over 20 million people. And I guess in hindsight, to some extent, it's not by design. It's maybe not a surprise that I've ended up working on cities and health, because all my entire life story is about different cities. So I was born in Lagos. I grew up there, went to school, primary school and some of high school. And then I moved to the UK and I finished school in the UK. I went on to do medicine, which is what I kind of was my very core focus from very early on. If there are any Nigerians on the line, you know that if you're good at school, anything is like, are you going to be a doctor or a lawyer or an engineer? That's the end of it. So I had an interest in the body and etc. So I was always going to do medicine. And then one of the interesting things that happened during medical school was that I took a year out and I did an additional degree, a separate degree, bachelor's in international health. And I think that really changed my focus, because I always wanted to be a pediatrician before that. And that changed my focus because it brought me back upstream to look at the big picture, to look at the factors outside of the hospital and outside of healthcare that influence health. And that really was, I think, also my first introduction to research. So after I finished medical school in London, I worked as a doctor in the UK, in Australia, in a city in Australia, in Sydney, back in London, got into HIV. And then I moved to South Africa to do some research in HIV. I went for 12 months and I stayed for almost 12 years, as happens to be the case. And that really started my transition from HIV and TB throughout the way up to urban health, because I saw patients in the HIV clinic and the TB clinic, and we're treating those. But then I realized that they had other conditions that we were not treating as well, firstly. And then I realized that a lot of those conditions were being driven by the exposures that they were walking in from. So I could tell them to eat well, but then there was no good food that was healthy around them. So I thought, I just feel a bit useless sitting in the clinic waiting for them to get sick, when actually the environment around them that playing a big role in determining whether or not they get sick. You know, I sit here as if it's inevitable they get sick, because actually there's a lot we could do to prevent them. So I then moved upstream into public health and focused on those environments and understanding, well, what are we doing in those spaces? What are people exposed to? How does that link with the diseases that we're seeing in the clinic? And importantly, how can we intervene in those spaces to create health, and see those spaces more as those kind of health services that I showed you earlier, and see them as health professionals. You know, I gave a talk to architects and I told them they were health professionals, because they make buildings that people live in and that determine their health. So that's kind of how I've ended up doing this. I only came back to the UK a couple of years ago, in part to focus more on the research I was doing. I started doing already. So I run a research group at Cambridge on global health. So we focus on the built environment and ways to understand lived environments and lived experiences, particularly in youth in Africa, in different cities in Africa, because we understand adolescents and youth as a key population group in general, but particularly in Africa, to intervene, because they are the agents of change. And then more recently, I set up the UrbanBetter, because actually we need a space that bridges the research with science, with the policy, with the private sector, with the civil society, to actually create that platform where we can come together and exchange information, but also create these new ideas that are not really, they don't sit well in either just academia or just policy. So create a neutral space that people can convene, and a learning collaborative where we can exchange information, learn between cities, because that's the other thing that's really quite striking across different cities in Africa, how siloed everybody is. You know, I ran a workshop last year and we brought different people together, and the resilience person in Lagos had never spoken to the resilience person in Accra. And then when they were speaking there, they're like, oh, you're doing that? Oh, I didn't realize. Oh, if I'd known you'd done that, then we might have tried something different. You think we just practically know each other. So how do we actually share more and learn from each other, so we're not all starting from scratch, so we can build on experiences and learnings from what others are doing, and importantly, how we can apply science and our kind of rigorous methodology in helping to create those interventions and to understand the impact of those interventions on population health. So that's me.
Do you have a couple of minutes? We'd love to. So you mentioned if you have, you asked if we have any Nigerian. So we're almost 40% Nigerian, 40% Kenyan, 20% Ethiopian, and 1 Rwandan. So we have people on the line from all over Africa. We have 4 out of 10 of our learners are women. Do you have a couple of minutes for people to say hello?
Yes, of course.
And so while we're kind of queuing that up, you've traveled a lot. What's the best place for Jollof?
Oh, I mean, come on. What are you trying to do to me?
I want to know what you have to say.
I mean, I know this is recording, so of course Lagos is the best place to get jollof. I mean,
you've been to Senegal, so I wanted to see if you were evidence-based or it was blood-based.
I'm not. I was doing a podcast with you might know her, Mariam Jammeh from Senegal. Yeah. So I was doing a podcast with her as part of the I Am the Code thing that she's got, and she posed that question. She says, "What does food mean to you?" And I was like, "This is a trap, isn't it?" We're going to end up in jollof wars. But yeah.
All right, guys. So
I feel tempted to speak.
let's get 5 people just to say hello. 5 of the learners, just say hello, what you're working on, yeah, where you're from. Lowell's busy trying to unmute himself. Lowell's always first. Who wants to go? Lowell's mic's not. Okay, so let's get somebody else. Let's get one of the ladies just to say hello. Anyone who wants to unmute?
Hello.
Hello, Cora? Yeah, go ahead.
Hello, Dave. Hello, Tollulah. Okay, hi, Tollulah. It's been an amazing section. Thanks for your smile and thanks for your attentiveness and your everything. I've gained a lot. So I'm from Nigeria. Yes, and I enjoyed this section. Thank you.
Thank you. Lovely to meet you, Ola.
Yeah, Cora, you want to go ahead? No?
Hello.
Hi.
Yeah, good morning.
Morning.
I think the first thing I actually did was to go through your profile, and I was like, wow. I was really amazed with your profile, and so it's really an interesting session speaking with you and also speaking to us. And to be honest, yeah, I've actually that passion to actually contribute to Africa and actually make Africa better in the area of public health. I've actually made that passion to arose in me, and I'm actually happy. And I hope to actually take this step further than this training. After this training, hopefully even contact you so that you can actually mentor me on this public health stuff, because I've actually been very passionate about anything that relates to public health, anything that relates to health in Africa. Thank you very much.
Lovely to meet you. Yeah, send me a message on Slack.
Okay,
Ken?
all right. Should I just?
Lowell, let's go to Kenya. We'll come back to you, Lowell.
All right.
Ken?
Hi. I'm Ken from Kenya.
Hello.
I'm really looking forward to participating in the challenge. In the challenge. It seems really exciting. Although it seems like really big, I'm pretty sure we'll manage the team.
Great.
Yeah.
Great.
Anastasia?
Love the spirit. Keep it up.
Hello, so
Anastasia?
good. I hope you can hear me.
Yeah, we can hear you.
Okay, so I'm Anastasia. I'm from one of the 40% from Kenya. And so I didn't know about this week's challenge, and I just went through it before this talk. I've actually enjoyed the talk because personally I find fitness and health something I'm interested in. It's part of my passion, and just to get to know that we can work on it so that we limit some health issues in future. I'm really excited to work on this challenge because it's part of my passion. Yeah.
Great. Lovely to meet you.
Lowell's busy, ready to go.
Lowell,
please go
we've been waiting for you.
Okay, all right. Thank you, Aaron. So good morning.
Morning.
My name is Lawal. So I'm currently in Niger State in Nigeria. So before the whole week session, I've already heard about you from Harun. He shared with me the urban setting. So I had to go through the website. It was amazing. So unfortunately for me then I didn't go. What I should have done was to put your name on Google. I would have seen your Wikipedia page. I would have known more about it. So, but then yesterday night when I saw the challenge, I was like, okay, let me go through it. And the first thing that came on was the client, Dr.Tollulah Oni. So then I looked at the link. I saw the Wikipedia page. So I went through it. So I was already blown away. So now the whole speech you had this morning, even though most of it was kind of esoteric to me, but then I still understand most of some part of it. So, but what struck me the most was part of how you moved from your medical line to a more impactful, in your own opinion, impactful passion and working about something that is related to your childhood experience, city. So it's kind of resonated very well with me and served as a reassurance that no matter the condition, the whole dream we have, because I don't know, Lagos is one of the places in Nigeria I pray not to live in. I have my personal reasons. So it served to reassure me that, okay, no matter how raw the starting is, how it seems as if the thing is not connecting, there's still a way that it would connect at the end. So yeah, thank you for being a source of inspiration, and I really look forward to the challenge. So yeah, thank you everyone.
Thank you. And you're right. The connections is everything. It's just, building that connection and growing that community. It's really nice to see the kind of vibe you guys have got, because that connection, the community that you're forming now is going to be everything. So don't underestimate those connections now. Yeah.
All right, last one. Do we have anyone from Ethiopia who wants to say hello? Otherwise, I'm just going to call on Binyam. Is Binyam here? I don't think Binyam's here right now. All right, Nabil.
Hello,
Nabil?
I'm Nabil from Ethiopia. Yeah, can you hear me?
Yes.
Yeah, we can hear you.
Yeah, so it's a great project. I'm excited to work on it. Yeah, thank you.
Nice to meet you. Nice to meet you, Nabil.
Nice to meet you. Yeah.
All right, great. Tollulah, anything else?
No, I think that's it. I look forward to seeing what you come up with. Maybe I should also say, for those who are interested, and I'll mention it again towards the end, who are interested in this topic area in general, just kind of ways of in creating healthy environments in cities in Africa. If you go onto that the UrbanBetter website, you can and click on the UrbanBetter page. You can join the movement, so you can leave your details and you can share what ways that you think that you would like to get involved, because part of that space is really for people like you, and it's really to create the space that you could connect to others. So do check it out and send your details if you're that way inclined beyond this. But more proximally, in the interim, I look forward to your outcomes from the challenge at the end of the first week, I guess, is the next step. Somebody asking me to close in Yoruba. That's like Esheo. I'm not. I'm very good at Yoruba, but only when I'm in Lagos.
Is that all you have to say? Because then I can speak Yoruba too. Esheo. Nobody ever told me that.
That sounds like something else, Aaron.
You see, the trick is to make people feel included. Like anyone can speak it, so I do that.
Yeah. All right.
Well, anytime you're in Accra, Ghana, do try our jollof, okay?
Yeah. I have to say, Accra came very close. Accra did well. You did well.
All right. Cool.
Okay. Thank you, everyone.
Thanks.
Bye. Thanks for coming. Bye.
Bye.